Well, the Free Market Foundation says its research suggests that South Africa's COVID-19 lockdown is costing the country at least 10 billion rand daily. The government began easing of its COVID-19 lockdown restrictions on the 1st of May 2020 from level 5 to level 4 with a number of new directives which amend what can be sold during South Africa's level 4 lockdown. Now, to discuss this further, we're joined on the line by Martin van Staden, Free Market Foundation's Head of Legal Policy and Research. A very good afternoon to you, Mr. Staden, and thank you so very much for joining us here on SABC News.
Thank you for having me.
Your research has suggested, of course, that South Africa's COVID-19 lockdown is costing the country at least 10 million rand daily. It's a scary amount, of course, to be losing. Where are we finding the sort of biggest knock? Which sector at this point has been sort of the hardest hit?
Well, I think we are most concerned with the informal sector. It's small businesses, sole proprietorships, and I think that is probably where most of this is coming from. I myself have not consulted the numbers on that specific research yet, but what we are reasonably clear on is that there is a massive rationality deficit between what the government wants to achieve with its regulations and what the Constitution and the law allows it to do. And for that reason, we think that government needs to significantly scale down on its regulations under the lockdown, if not completely end most aspects of it. Otherwise, South Africa's long-term position is going to be far worse, I would say, than whatever this virus can inflict on us. You need an economy to solve poverty, for instance, and if we destroy the economy in the process of fighting what is going to be a temporary health concern and end up destroying the economy for many decades to come, that cannot be rational and that cannot be right. And we need to take action as South Africans and demand that government significantly scale down this lockdown, maybe take us down to level 3 immediately and then in close succession all the way down to level 1.
I mean, this is not frivolous reasons why our government has had to take such drastic measures. So perhaps then I should then ask you, how do we then strike the balance? I mean, this is something we've not experienced before. A global pandemic in our lifetime is something that we've not necessarily experienced. So I think if you're saying that, we need to scale down on those regulations, how so when, we're faced with this life-threatening global virus? I mean, we're seeing so many deaths across the world. So, is the balance, if you're looking at it, not being struck at it properly?
Well, look, yes, I think we should all concede that this is, for many intents and purposes, uncharted territory, and for that reason, I think the criticism level that government has been quite toned down for what it would ordinarily be. So I think everyone appreciates that government is in a somewhat difficult position and in many respects is following the example of other countries. But then again, South Africa is one of the most restrictive lockdowns, and in that respect we're leading in the world among some others, and I don't think that's necessarily a good thing to lead in. An overreaction is something that can happen, and I think has happened. So for instance, some of the absurdities that you might see in the lockdown regulations is that children who, for most intents and purposes, are quite, I wouldn't say immune to the virus, but have a very strong resistance against the virus, they are forced to be home. They don't pose a risk to each other at school, for instance, but they are home in many cases with their grandparents, with older people who are at risk. So that's a small example of the irrationality of the restrictions. But then again, also the alcohol sale ban, the cigarette sale ban, people are are going to stores. I mean, that's happening. Everyone needs to buy essential items, so they will go to stores, and there will be many people lined up outside of stores and inside the stores, and prohibiting them from accessing something that many people are, unfortunately, of course, addicted to, may cause longer-term health consequences for those individuals. Discontinuation syndrome is a recognized health concern, and if you take away someone's alcohol and their cigarettes from them, I say this as a total teetotaler, I don't consume either of those, but that is a dangerous thing to do, and that is something that government has done. And up until now, government has failed to provide adequate, reasonably acceptable justifications for these bans, as it is required under the Constitution. We are a constitutional democracy, and we need a culture of justification. And government has said it's not going to make minutes available of how it came to a certain decision.
Yeah.
Now, we're happy that Minister Onkosazana Dlamini Zuma has announced that she will justify those regulations, but after a lot of demands from civil society. We need a more responsive government in this respect, and we simply need government to apply a proportionality analysis and be as least restrictive as it possibly can. These new regulations by Minister Patel are totally absurd, and that's definitely not proportional.
Yeah, you know, I'm trying to remember which African leader said this, but I'd really like to hear your take on it. He said that, you know, we're able to bring back the economy to life, but unfortunately, what we don't know is how to bring people back to life. What's your analysis on you know, a statement like that? The fact that, you know, it's being said that we can't, you know, risk people's lives for the sake of the economy. Is that important to you?
I think it's very important to note that there is no distinction between lives and economy. People depend on the economy to live, and unfortunately for South Africa's poor, that dependence on the economy is so much more acute. If our economy gets any weaker than it already was coming into the coronavirus, and I would remind viewers that we were in a recession by the time this virus pandemic began, if the economy gets any weaker, and it is quickly getting much weaker, the poor will be, unfortunately, the first ones to bear the brunt of this crisis. I mean, this idea that that's been said on social media and other places, that it's the middle class and the rich who are only concerned with the economy but not with people's lives, I think that is a gross oversimplification and simply misses the point that people need to work to put food on the table. Government is not making or collecting nearly enough in taxes to provide all poor South Africans with enough food to provide all the necessities for the poor if the economy collapses. And if the economy collapses, government revenue, as it has already begun, will simply collapse entirely, and then we'll be in somewhat of a permanent situation whereby South Africa is no longer an investment destination at all.
Thank you so very much,
Martin
van Staden. Unfortunately, we'll have to leave it there. We are out of time. Thank you so very much for giving us your time. We really do appreciate it. That's Martin van Staden, Free Market Foundation's Head of Legal Policy and Research. More news after this short break at the top of the hour.